I now invite Dr. Debraj SHOME to present his talk. As we all know, Dr. Debraj is the known name in cosmetology all over India and director of the aesthetics clinics in Bombay and multiple centers all over India. Welcome, Dr. Debraj.
Thank you, Shilpa. Thank you, everyone. Thanks for coming here early in the morning after the gala. And it's always nice to meet up all my fellow conspirators on this particular course. My name is Debraj Chom, and we practice mainly aesthetic medicine. Now, why are you sitting through this? I always use this in every ophthalmology course, and the reason for this is that if you look at aesthetics in ophthalmology, it's growing steadily. And if you look at this American Academy of Ophthalmology article, which got published just prior to the pandemic, this particular article actually said that by 2030, you will have aesthetics as one of the major contributors of revenue in eye hospitals. And that's very important. When I train multiple people, and I have trained plastic surgeons, dermatologists, general surgeons, ENT surgeons, max fac surgeons, however, the most difficult part for injections is actually the periocular area. And when you look at the periocular area, ophthalmologists have a disproportionate advantage because they are not scared of the eye, unlike other specialties. And that's why you should definitely look to get trained in aesthetics and use that appropriately. This is also important because majority of our oculoplastic training programs are only looking at things around the eyes, but unless and until you treat the face holistically, it doesn't really suffice. I mean, fractures or whichever disease you're treating does not necessarily end up getting restricted to only the periocular area. So you've got to treat other parts of the face as well. Now, this is one slide that I always bring up. And this is just to show you the power of incremental change. She's 30 years old, and you can probably form an opinion on her face, and you would probably rate her from 0 to 10, right? How do you think she looks from 0 to 10? Can't hear. 0 being the least, 10 being perfect. What do you think she looks like? 5, 6, perhaps? Okay. What do you think? And she's aging, right? Every few years she's aging. What do you think? Okay. So the power of incremental change is immense. Any other part of the face, any other part of the body, what takes an inch to make a difference on the face is a couple of millimeters. And who understands millimeters better than ophthalmologists, right? I mean, ophthalmic surgery is all about precision, and that's why aesthetics is something which is very important for ophthalmic surgeons, in my opinion. I'm a diplomate of the American Board of Facial Cosmetic Surgeons, and in the US American Board actually has 30% or more people coming from an ophthalmology background, and that's the change that we through this course want to drive in parts of Asia as well. Now, when you look at faces, it's the OG curve. It's basically a S-shaped curve. But in general, the most important salient point is that your tissues are moving downwards and medially, brought about by descent, which is caused by the gravitational pull. So if downwards and medial movement of the face is actually your, what's causing aging, anti-aging would be anything which causes the face to move upwards and laterally. Why does the face age? There are multiple reasons. I don't think we need to go into the details, but in general, what is basically happening is that there are bony changes, there are skin changes, and there are mass-related changes, which are all causing the face to come down. In general, if you turned around and said that it's mother gravity which is pulling you closer to herself, that's really the reason for understanding how aging occurs. Now, this was the first paper on aging of the Indian face. It came from India, but there was no data available from all of South Asia, and we are genotypically similar in Bangladesh, in Pakistan, in Nepal, and multiple other countries. This particular paper which came out actually used a number of serial and sequential photographs to look at how Indian faces age. Now, obviously, aging is also a pattern, just like other diseases are. And unless you can actually identify how people age, how will you go ahead and practice anti-aging? Now look at her, try and understand the patterns which are occurring. She's 23, she's 37, and she's 71. Essentially, the most important thing is the shape of the face changes as you age, which is also one of the reasons that the face is becoming broader. And if you look at that, you understand that if you want to make faces, if you can make faces appear narrower, it will automatically look younger as people age. Look at what happens when the person goes to 76. Again, similar sort of faces, 20, 34, 45, and you can see the shape of the face is changing from an oval shape to a more roundish or even a squarish shape. And then you also look at the cervicomental angle, how that's getting completely changed and becoming obtuse as people age. If you're a male, you're also losing hair, which also makes the aging process progress further. Now, look at these sort of faces as well, right? So what did we discover? We discovered that the upper third of the face, because of the melanin in our skin, tends to age relatively well. It's really the mid face and the lower face which ages significantly, which is why also I make it a point to tell everyone that India is not really Botox and filler country. It's more of the lifting country because it's a sagging which is causing the neck as well as the jowls to become less defined. And so you have to look at lifting procedures. You have to look at procedures which reduce the volume of the face rather than increase the volume of the face. And that's very important when you come to South Asia. This is an interesting paper. I would request everyone to read this. It's by Lamperl. It talks about how the nasolabial folds age and what is the different classifications of the nasolabial fold severity. But for a face like this, which has just a line, it's just a valley, it's very simple. You can take some filler and you can put it just below the skin, and this is the sort of result you get immediately after. Obviously, the filler will absorb more water and it will become more set over a period of time, and you'll see better results over a period of time. But when you look at faces, you should always be looking at essentially dividing the face into the upper third, the middle third, and the lower third. And when you look at these sort of patients, upper third, middle third, lower third, it becomes very important to figure out where the problem really lies. Because we are not only scientific consultants to our patients, we are also financial consultants to our patients. So in this particular patient, you can see the right eye is very different from the left eye. Even though the light reflex is right in the center, there is a inferior scleral show as well as a lateral arch to the lower eyelid, which is there on the right side, which is not there on the left. And especially when she smiles, you can see the difference between the two sides of the face becoming even more stark. This is apparent not only in the eyes, but all over the face, right from the top to the bottom. You can see that the left side of the face is the saggier side of the face. It's also the more contracted side of the face. Now, what do you do? I mean, in a patient like this, we would use my earlier speakers, Dr. Kasturi, Dr. Shilpa, Dr. Adit have done a wonderful job already, but basically a little bit of Botox here, just the way that some of them have shown, and a little bit of fillers like Dr. Kasturi has shown, and those are the sort of results you can create, right? So you can take the patient from here to here literally in the space of minutes. Now, you could also potentially on the right side do a lateral tarsal strip. But do you want to do a lateral tarsal strip? Do you want to perform surgery? Is it necessary to perform surgery? Those are the questions which need to be asked. Now, a patient like this, I'd request no pictures to be taken of patients, please. If you can please respect the privacy of patients, that will be appreciated. Thank you. So if you look at this particular patient, she's 32. She comes in at 32. She's got the right side of the left side of the face is higher. The entire left side, including the brow, appears to be higher. You also have left under eye fat bags, which are more prominent than the right side. You could do a blepharoplasty, but my question to you is at 32, do you want to do a blepharoplasty? And do you want to do a one-sided blepharoplasty? So you could treat these with fillers. My point is not that you have to use fillers in every case. My point is simply that if you have multiple tools in your armamentarium, you will be able to give the right sort of treatment to your patients. Neither bleph is correct nor fillers are correct. The right and the optimal use of both of this is correct in the appropriate patient. Now, which lasers do we use? These are our workhorse lasers, the carbon dioxide laser as well as the Q-switched ND YAG. And learning to work with other specialties and collaborating with dermatologists is very important, because unless and until you collaborate with dermatologists, how will you treat a patient like this? For instance, this patient has undergone trichloroacetic acid peels, lactic peels, and 8 sessions of Q-switched ND YAG laser. as there was also this very interesting paper from my alma mater from LV Prasad, which showed that if you have a patient undergoing LASIK surgery, patient actually post the LASIK is more unhappy than before the LASIK because under eye dark circles tend to show up. And if you're not able to treat the under eye dark circles as a ophthalmologist, then what are you doing taking the glasses off in the first place? So that's why this is important, right? Now, when you look at some of these patients, you see eyelid bags. But again, like I said, the whole objective is to know that there are different ways to skin a cat. And the way to skin this particular cat was basically doing a little bit of fillers and a session of carbon dioxide laser to tighten the skin, which can give you results which are almost surgical-like. And knowing when to do what, like I said, is very important. So this patient, crepey skin, very deep and hollows all over, just like Dr. Kasturi had shown in the under eye area. So using Botox and fillers first, then doing a carbon dioxide laser, and then using the carbon dioxide laser to decrease the crepiness of the skin and tightening the skin, that's the combination therapy which would lead to better results. Now, you see a patient like this, and perception becomes your reality. I mean, at the end of the day, your face is the perception which is being presented to the world. She was 46, but she didn't come in to look young. She came in because she thought she looked worried, and she didn't want to look worried, she didn't want to look stressed, she didn't want to look fearful. All of those are perceptions which can be driven. You can actually do a little bit of Botox, a little bit of fillers, and transform the face completely. So she still probably looks 46, she looks younger, she looks more relaxed, so essentially what I say about our work is we match your soul ages to your face age to your soul ages. So if you feel 16, well, not 16, but we can definitely make you look 25, even if you're 60. Some of the faces that you see will be very heavy faces. Now, that's a face from the Middle East, which is the Gulf countries. And when you see these faces from the Middle East, you will find that in addition to a valley, there is also a mountain which is there. And unless and until you can raise the mountain, you will not make any change to the valley. So the first thing is to actually use a high G prime filler, which is used laterally. The CK1 point becomes very important for that, or the L1 point as it used to be called earlier. And when you use a G prime filler, which is lateralizing the face and pulling the face up, you can actually get the mountain to move up. And once the mountain moves up, then you do a little bit of fillers in the, area of the nasolabial folds, and those are the sort of results you can create. Knowing how to do threads is also very important. Threads is something that we've been using for the past decade plus. I know there are certain countries in the world where people are worried about using threads, but believe me, we've used threads everywhere on the face, including in the nose. How do threads really work? Threads are basically like the stem of a rose, and essentially what they do is they lift the face from the inside. And as they lift the face from the inside, they actually engage the skin and lift it up, leading to very good results. These results last for 2 years plus. Now, in heavy faces like this, the threads become very important. In a face like this, if you were to do only fillers, you would actually add to the heaviness of the face. So lifting the face becomes important, not just filling the face. So what you do is you first lift the face with the use of threads. And after you've done that, then you layer the face with the fillers in the appropriate area. And then this patient is also post carbon dioxide laser, which is why you see the scabs on her face. What do you think of her? When you look at her and she's 48 years old, she probably looks very stern, right? She looks angry. But she's not really angry. She was a very pleasant lady. And how you look can make all the difference, right? So a little bit of high G prime, low G prime fillers, threads, etc. And that's the sort of results that you can create. And she looks more pleasant. And sometimes it's about making people look like a better version of themselves, not necessarily younger, not necessarily older, and more optimal version of the perception that they want to create. So I encourage everyone to think of people's faces as the gift wrapping around the gift, and you need to wrap the gift appropriately so the presentation to the world changes. Now, we also use a lot of medical devices, obviously. And if you use medical devices, then the Althera, which is the only US FDA approved device for non-surgical facelift, becomes very important. And the Althera is something which releases high intensity focused ultrasound. It's below the skin, causes collagen formation. One of the major reasons for aging is that collagen has stopped being formed in faces which are above the age of 30. And so Altera actually causes collagen formation, which improves the structure of the face and causes the face to be lifted up. How does it really work? This is the Altera being done. And essentially what you're doing is, it's just a device. It's a little painful when it's getting done, but it delivers ultrasound energy, causes the basement membrane of the face to actually deliver collagen, and takes things to the next level. That's another patient of ours undergoing the Altera. The Altera has pretty much transformed our practice. We were one of the first practices in India to invest in the Altera. And from 2017 to now, my facelifts or our facelifts have reduced by about 60% because the Altera is able to give very decent results. If you ask people how many people want to look young or better, probably all the hands in the audience will go up. But if you repeat the question and say how many want to undergo surgery to look better, then the number of people will be very low, because surgery, we understand as surgeons, could be unpredictable, and that's why non-surgical treatments work really well. These are almost surgery-like results, right? I mean, when you look at her, and this is actually the wife of the earlier Consul General of India from the United States, and when you look at her, you can see how her face has become much narrower, a concept that I explained in the first few slides, and you can also see how her jawline has become much more contoured, her double chin has completely gone. So for the lower face, really, there's no real substitute to the Altera. It works wonderfully well. Similar sort of a patient, and these are the results which are created. Look at how his entire facial shape changes. From a roundish face, how he becomes much more angular face, and he hasn't lost a pound, but he looks like he's lost quite a few kgs, and that's because the shape of the face has changed. Another device that we invested in very early was the Venus Freeze, and when you use the Venus Freeze, it's a quadrupolar RF with magnetic fields, and when you use the Venus Freeze, it causes tightening as well. So different technologies become very important in taking things to the next level. We also use the Sigma lift a lot. This is something we acquired in the recent past. This is fractionated HIFU. So it's the Altera minus the pain and minus the consumables as well. So it makes the treatment slightly cheaper and more bearable in terms of pain. The Sigma lift is a fantastic device, produces great results, and is something that we use a lot as well. One of the big advantages for all of us is that we are surgeons. Now, my talk tomorrow, we have an instruction course tomorrow on facial cosmetic surgery in the adjacent hall. My talk tomorrow is on the deep plane facelift. And the deep plane facelift is something that I've done possibly 2 dozens of in the last 6 to 8 months. And the reason that we do surgery is that not everything can be treated with fillers and with Botox and with threads, right? We are surgeons, so we need to know surgery. The mid-face lift is not the same as the deep plane facelift, but this is something that is even simpler. So essentially what you do is you go through the superior vestibular sulcus, you take 20 Prolene sutures through the malar fat pad, tunnel it above, blind, above the zygomatic arch, and through a temporal incision behind the hairline, and then tie this particular suture onto the deep temporal fascia. The moment you do that, you see the left malar area looks higher than the right malar area. And when you are actually transmitting this, you can see how the pull gets transmitted. It's a small 45-minute procedure, and it lasts about 5 years plus. Very good results. And the big advantage of the deep plane facelift, the mid facelift over the deep plane facelift is the mid facelift has scars which are inside the mouth and behind the hairline. So it is relatively invisible scars that you get, and that's why it's a great treatment to do. How do you do this? And what happens when you do this? 68-year-old grandmom who came in wanting to look younger because her grandson wanted her to look younger. She came in from the US. And when we did an upper and a lower eyelid blepharoplasty, please don't take patient pictures. When we did upper and lower eyelid blepharoplasty with carbon dioxide laser and a mid-face lift, it transformed the face completely. Similar sort of a treatment done in a 70-year-old where we've used mid-face lift, blepharoplasty, and CO2 laser resurfacing to really make the eyes open up, but also make the person look a much younger version of themselves. This is a patient of ours who actually has been following up for the last 12 years. So the thing to remember about aesthetics patients are they develop faith in you. Once they develop faith in you, they want to stick with you for life. They are going to age next year more than this year. So you'll continue to treat them. So initially we did fillers, then we did threads, then we did the mid-face lift. And then after you did the mid-face lift, this is after the surgery, you can see how the face has got transformed. So essentially, if you have multiple tools in your armamentarium, you'll be able to treat people on a large continuum of problems. You're then not using only a hammer, and then everyone doesn't look like a nail. This is another surgery that we do a lot. It's basically a liposuction of the face. You're removing fat from the lower part of the face and transporting that to the higher part of the face. And then once you do that, the shape of the face changes. Please don't take pictures of patients. Request you to not do that. And the moment you take photographs, the moment you take the fat out from the lower part of the face and transport that to the upper part of the face completely changes. And the shape change in the face can transform all sorts of things. That's coming to my last few slides. 48-year-old who wanted a dignity back. This is not surgery. This is a combination of treatments using Botox, fillers, threads, Althera, lasers, etc. And you can see how the face shape completely changes. I mean, as you start using fillers, even 16, 20 syringes per patient does not seem too much if you know how to use it in the right places. People turn around and say that people on television look funny, but they don't look funny because of the fillers which have been injected. They look funny because of the way the fillers have been injected, and that's the most important thing. Masseter Botox has been spoken about by Shilpa, but you will be surprised at some of the results that masseter Botox can cause. It's a very simple 5-minute procedure. When you do that, look at the change in the shape of the face of the patient. You would think she's lost 10 pounds, but the essential fact is the shape of her face has changed. And if you look carefully, you can see how sequentially this goes. This was a paper that we've published now. And this is a paper which shows that if you do this 4 times, you can actually have results which last for 4 years plus. If results last 4 years plus in changing the facial shape and making it narrower with the help of Botox, why then do we need angle surgery of the face? Madam talked about non-surgical rhinoplasties, and I mean, I always say this, until 2018, I had not even gone ahead and done a single non-surgical rhinoplasty, but nowadays, this is one of our most offered procedures. In fact, if my surgical rhinoplasties have been 1,000 plus over the last 10 to 12 years, this itself would have crossed 500 plus in the last 5-6 years itself. So the very common procedure now, and it makes a big difference, as you can see in some patients. You can also use threads for noses, which can lift the nose up. The objective is to lift the nose and to make it look narrower. When you do that, you can see how the entire nasofrontal angle as well as the shape of the nose changes. Even the nostrils change. The base of the nose is pulled up. Lots of differences. I mean, you know, people say threads don't work. Ultimately, nothing works unless you know how to make it work. This is a beautiful lady. She's an actress. And when she smiles, you can see how the tip of the nose comes down. And look at how, just by doing fillers, threads, etc., you can change the shape of the nose. And if you can change the shape of the nose like this with no downtime, then why would you want to do surgery? So that's something that we need to know. We need to have different tools in our armamentarium. All in all, I mean, you know, injecting fillers is not for everyone. You need to know when to use what, how to do treatments better, and transform faces. Ultimately, you can get surgery-like results, and these are surgery-like results. You can shape a hook nose, you can shape the deviated nasal septum, you can actually get the tip of the nose to move up and change the way the entire projection of the nose as well as the entire rotation of the tip occurs, and that can be done with the help of threads and fillers and so on and so forth. So that's it really. That's what I wanted to talk about. 2 more minutes to go. These are the papers which have been published from the aesthetic clinics over the last few years, and trying to contribute as much as we can to science. And we've got a wonderful team, and you know, they help us look smarter than we actually are. So all in all, what I would like you to take back is that knowing when to fill, when to reduce, and when to lift makes all the difference. And ultimately, if you can treat people well, that is when you'll end up making a big difference to their lives.